Hello, hello. Just wait for some people to join on. Marshun's gonna join us. Already got Marshun coming on. Hope everyone's doing okay. Hello. Oh no, you're frozen. Wait, it's loading. Give it a sec. Hello, can you hear me, Marshun? I think so. Wait, say something again. Yeah. We'll figure out what's going on. Love tech issues during staying at home at COVID, but we're going to be talking about HIV Long-Term Survivor Awareness Day and celebrating all of that today. So I'm going to type out just the... Oh, hi, I can hear you now. Hello.
Hey.
How's it going?
Pretty good. I'm having a really good day today.
Good. Loving the eyeshadow.
Thank you.
Just this little thing, you know.
Try to do a little wing.
I see it. It looks great.
Thank you.
All right, just give me a second to type out this pinned comment here, and then we can get going.
Okie dokie.
Do. Almost there.
I'm so glad you can figure that out because I can never figure out trying to pin the comment.
We're gonna see if I figure it out. I'm just typing it out right now.
Okay.
Wait, okay.
I think you got it.
Oh, it's pinned. We're doing great things.
Okie dokie.
Okay, so let's introduce ourselves. Let's get it going.
Okie dokie. I am Marshun. My pronouns are he and she. I work here at Whitman-Walker Health as a community outreach specialist.
Awesome. Hi, Marshun. I miss you.
I miss you more. JJ, how are you?
I'm doing okay. I think as best as I can. I'm happy that it's Friday for sure. Happy Friday to everyone out there. Also checking in the comments. We want to know how you're all doing too.
Yes.
But my name's JJ. My pronouns are he, him, his. And I'm the social media outreach coordinator here at Whitman-Walker, and also a health educator. So we've been bringing you lots of this online content together. And today, like we said before, if you're just tuning in now, we're going to be talking about HIV Long-Term Survivors Awareness Day and celebrating our long-term HIV survivors. So before we get started, just want to explain that during the past few months, Whitman-Walker's Community Health Department, so the department that we're part of, has expanded its outreach efforts to the social media platform. So if you've been paying attention to what we've been doing, we've really made a big push to reach you online, especially during COVID-19. So we cover various topics about HIV and STI sexual health practices, access to care, social determinants of health, and general public health interventions. So this series of outreach sessions will focus on the current pandemic, COVID-19, and ways to manage your sexual, personal, and mental health. So the community health team, which we're part of, is here to educate and support you.
Period. And so, like JJ said, today is June 5th, and we honor HIV Long-Term Survivor Awareness Day. And today we're going to hold a conversation around HIV, treatment as prevention, stigma, and access to HIV services.
For sure. So let's start this conversation off. Y'all can participate in the comments too, with a few little trivia questions that we have prepared to kind of test everyone's knowledge of HIV and kind of get the conversation started. So Marshun, I have 3 questions.
Oh my God, okay.
See if you can handle them.
Oh my God, okay.
So first one I have is, which of these systems does HIV infect in our bodies? So is it the nervous system, the immune system, or the circulatory system?
I'm gonna say immune system.
Ding, ding, ding. We have a winner.
Yes.
He's always winning. I'm no surprise.
Stop
Um,
it.
so HIV stands for Human Immunodeficiency Virus. Well, we're going to get into all these nitty-gritty details in a second, but just for like some preliminary information, it weakens the immune system, like Marshun said, so it leaves the body more susceptible to other diseases. And AIDS happens when HIV goes untreated and causes further damage to the immune system. So HIV unfortunately cannot be cured right now, but we do have something called ART, or antiretroviral therapy, which makes living with HIV completely manageable. So, are you ready for your next question?
I think so.
On the hot seat. All right, so this one is, how can HIV be transmitted either through unprotected sex, through needle sharing, or through both of the above?
I think both.
It is both.
Definitely.
Another ding ding, right answer. So we're going to go over this more in detail too, but HIV can only be transmitted through 5 bodily fluids. So we got 5 of them: blood, semen, which includes pre-cum, rectal fluid, vaginal fluid, and breast milk. Those 5. So when you think about transmission, just kind of keep that in mind. And then some important prevention methods around those fluids include condoms and lube, PrEP, PEP, getting tested regularly, and using sterile needles. And someone who's living with HIV but whose viral load is undetectable actually cannot transmit HIV to someone else through sex. So that's called undetectable equals untransmittable. You equals you. We love you equals you.
We love you equals you.
Claps for you equals you,
Baby,
for sure.
clap for you equals you.
Yeah, round of applause. Love to see it.
Round of applause.
All right, so final question. We're 2 for 2. Let's see if we can go 3 for 3. So this one's about DC and HIV. Which population here in DC has the highest proportion of residents living with HIV? Is it Black women, Black men, or Latinx men?
Okay, so I just moved here.
Mm-hmm.
But I'm going to go for Black men.
You're going to go for Black men. I see.
Yes.
Correct.
Oh!
Yet again.
Yes!
Wow, 100% A+. He passed. A++++. So 3.8% of Black men in DC are currently living with HIV, and that's the highest proportion of residents here in the district. The next highest ones are Latinx men, which is at 2.1%, and all the information is from 2018, which is the most recent data that we have on this from DC's Department of Health. And then after Latinx men, it's Black women at 1.6%. And then we get in a little bit more to other demographics. So Black MSM, or men who have sex with men in DC, made up 28% of newly diagnosed HIV cases here in 2018. So clearly we're seeing that the HIV epidemic disproportionately is affecting queer communities, communities of color here. And we're going to definitely talk about that a little bit more as we go on. So
okay, definitely. I feel like since we just had this cute quiz, maybe we should dive a little deeper into HIV. What do you think?
I think it'd be cute. I think we should go for it.
Yeah, definitely.
So, Marshun, to kind of dive into this a little deeper, do you want to talk a little bit about what HIV is and how it specifically impacts the body?
Absolutely, yes. Okay, so HIV stands for Human Immunodeficiency Virus, which pretty much destroys your CD4 cells. Your CD4 cells are your helper T cells, which pretty much help suppress or regulate your immune system responses. HIV also prevents essential immune system functioning, which makes your body more susceptible to opportunistic infections such as, pneumonia. I was going to say pneumonia.
Pneumonia. That's where our brains are at on a Friday, especially during these times.
A normal CD4 count is between 500 to 1,500 cells per milliliter of blood.
I think it's microliter, actually, but 500 to 1,500.
Okay. Yeah. Thanks, JJ. That's why you're here. Help me.
We're helping us help you.
Yes. And if you have if you have below 200 cells, you're at a higher risk of, contracting illnesses, which is why we always recommend you starting your ART, which is your antiretroviral therapy, for all HIV positive individuals, regardless of whatever your CD4 count is.
Definitely.
And like what we're talking about, HIV and CD4 count, I know a lot of people get confused, JJ, when it comes to, HIV and AIDS, because people like to just put it under one big scope.
Exactly.
When it's two completely different things.
Yeah.
So do you mind like briefly touching on the difference between HIV and AIDS?
Yes, definitely. So the difference kind of is best explained when I talk about what the three phases of HIV can be. So this looks different for everyone. It looks different based on what like therapy you get on, like what treatment you get. But overall, the three phases. So there's an early acute phase, which can happen pretty soon after you first become infected with HIV. So that's when people think about you get that high fever spike and that coughing and like that kind of thing. It does not happen to everyone. Like this is not a set like course that people always follow, but it can happen. That's what first happens. But then after that, it then transitions into a more latent and chronic phase. So the virus is still in your system, but you're not showing as many of those like symptoms that first came on that first time. And then finally, if you're not on treatment and you're not really seeking care at all, it transitions into its final phase, which is AIDS. So that's what the difference is between HIV and AIDS. That AIDS is kind of defined by that last stage if you don't get on treatment. And it's defined especially by the number of CD4 T cells that are in your body at the time. So actually, different countries and different places define like exactly what that number can be. So in the US, it's fewer than 200 cells per microliter. It could also be less than 14% of your total when you like were first diagnosed. Or it could also involve the presence of an opportunistic infection. So any of those three categories could then put you in the AIDS category as opposed to HIV. But that's the main difference for sure is between HIV and AIDS. So hopefully that explains that a little bit better for everyone.
Yeah,
again, if anyone
they cleared it up.
Yeah, and if anyone has questions, definitely drop those in the comments. Comment. We're here for everyone.
And let's actually cruise through the comments, Roderick voice. Let's see what they're talking about. Do we have any questions? Oh my God, it's a lot.
I'm seeing lots of good comments about the eyeshadow, which I completely agree. He knew he was making a statement today. Let's be real.
Y'all play too much. There's no cure for HIV currently, but there is treatment, which is your ART, your antiretroviral therapy. And if you ever need linkage to care, or if you know someone who's positive and they need treatment or whatever, you can always refer them to Whitman-Walker. We have a red carpet program who will just walk them through the entire process of everything.
Exactly. That information's on our website, or you could call the number also that's pinned in the comments right there, which is 202, why can't I look at it? 797-4439. That's where truly anything that you have any questions about, drop it here or call that number.
And everyone, feel free to check in. Let us know how you're doing in the comments, just because it's very important, especially with everything going on right now, that we check in with each other, because we're all battling things differently. We all process things differently. And so it doesn't hurt just to do a cute little, hey, JJ, how are you?
Love that.
Okay. So, JJ, I guess.
We also just got another question real quick, actually. So the question is, how long after infection will it show up when you get tested? That's an awesome question. So it depends on the type of test that you get. So there are two main, we're actually going to go over this later, but since it's such a good question, we can do it real quick here. So there are two main types of got a phone call.
Yes, the perfect phone call.
Yeah, love that. But this first type of test is a third generation test, and that's typically a finger prick test. It could also be an oral swab, but we at Whitman-Walker, we typically do the finger prick test. That has a 3-month, we can't see the pin anymore. Sad. Oh,
yeah, it has a 3-month window period. And although we aren't offering testing at the moment, if you want to call the number below, we can refer you to different organizations who are offering testing, since we aren't currently.
So yeah, it's 3 months for that one, and then for up the blood test, which is a 4 month one, which we also can offer. Um, that one has a 2 week window period, so you would have to wait 2 weeks after you were possibly exposed to then get an accurate result on your test there. I'm typing out the pin comment again, since actually, is it all the way? If I scroll all the way to the top, is it still there? No, it's not. I don't know what happened. Can you still see the pin comment, or is it just gone?
I see it, but it won't allow me to pin it because I didn't start the live.
Sorry. Okay, I don't see it anymore. And
It's like
I
scroll
see,
all the way to the top, like oh.
yeah, I did. It's
Oh
not
my
there.
God. Okay. Well, while
Okay,
you do that, I guess I'll go over, since
cool.
we talked about the difference between HIV and AIDS. Now I'll briefly go over how HIV is transmitted, because I know there's a lot of confusion around that at times. So
Perfect.
there are 5 fluids that transmit HIV. The first one is blood. Of course, a lot of us may know that already. The second is semen. The third would be rectal fluids. The fourth would be vaginal secretions. And then the fifth one would be breast milk. And I'm going to actually go over an estimated per act probability of requiring HIV from an infected source by the Exposure Act. And so these exposures are per 10,000 exposures. So if you get confused, just write in the comments and I'll try my best to explain it more to you. Okay, so now I'm going to go through the types of exposures and the risk per 10,000 exposures.
Love
so, blood transfusions, they're at 9,250 exposures. Needle sharing during injection drug use, the risk is 63 per 10,000 exposures. And if you have like a needle stick, the risk is lower. It's 23 per 10,000 exposures.
Yes.
If you engage in resective anal intercourse, the risk is 138 per 10,000 exposures. If you engage in insertive anal intercourse, it's 11 per 10,000 exposures. If you engage in resective penile vaginal intercourse, it's 8 per 10,000 exposures. And if you engage in insertive penile, and I feel like maybe we should post this so that people can see, because I know it may be kind of weird me saying it, but if you engage in insertive penile vaginal intercourse, it's 4 per 10,000 exposures. Resective oral intercourse and insertive oral intercourse have a very low risk of transmissions.
Yeah.
And biting, spitting, throwing bodily fluids, or sharing sex toys has a very small risk of transmission.
Gotcha. So I see we got a question that said, like, what if I'm a top or a bottom? What's my risk involved with that? And so when Marshun was talking about it involved like the how many per 10,000 exposures, right? So
right. So
we see.
If you're a top, it would be insertive anal intercourse, and that's 11 per 10,000. And if you were at the bottom, it would be, you have a more likelihood of contracting it because 180 per 10,000 exposures.
Yeah. And so I think what that, like, to sum that up basically is that usually if you're bottoming, there's a slightly higher chance of contracting HIV, but that doesn't mean that you are immune. If you are topping either, there's definitely still a chance of exposing yourself to HIV. And there are a lot of different other like sex acts that Marshun just went through that aren't exclusively like insertive or receptive like intercourse. So there's a lot of different things that can be involved with like top or bottom.
Right, and I'm happy she brought that up, whoever commented that, just because it's important, like just with language use. And I know we may get confused at times. If I'm having sex, am I at risk? Yes, which is why we always recommend you using condoms, dental dams, maybe, starting PrEP, just because there are multiple tools, to put on your toolkit, your tool belt of safe sex practices.
Exactly. Yeah. So we definitely encourage everyone to kind of explore their own safe sex toolkit, which could definitely involve condoms, could involve PrEP. But basically, at the end of the day, if you are having sex, you are at risk of
Right.
becoming infected with HIV.
So
So good
JJ,
questions. Thank you.
what are some important language to keep in mind when talking about HIV? Because I know like people say things and it can be offensive to
Hmm.
some. So what are some like tips for us to keep in
Yeah,
mind when we are discussing, HIV?
definitely. So we all know HIV and AIDS are very stigmatized, especially going back
Right.
to the origins of the HIV and AIDS epidemic, with our queer communities being really labeled with the disease and it being so stigmatized in those communities and now communities of color and everything. So I think it's really important that we know what language to use to talk about this to
Right.
eliminate that stigma. So a few good tips. First one has to do with the difference between HIV and AIDS because they're not the same thing, um,
Right.
which we just went over. So if you are referring to someone who is living with HIV, it's important to say HIV and not AIDS. So that's
Right.
one thing. Um, Other thing is you wouldn't say that someone has died of or from AIDS, since no one dies of or from AIDS. It would happen because of another infection, right? So because the HIV virus weakens your immune system, those like pneumonia, those other types of infections are what can kill people. It's not AIDS itself. So instead, you would say died of or from an AIDS related illness. It's not of AIDS itself.
Right.
And then the last thing, people always say things like an AIDS patient or an HIV patient, or you're suffering from HIV, or you're an AIDS victim, like that. I think that's definitely, we need to turn those words kind of on their head and like be a lot more empowering about it. So especially because living with HIV can be completely manageable now with the treatments
Right.
that we have. So instead of
And
any of those phrases,
saying it just pretty much just supports the stigma around HIV
exactly.
altogether. Hmm.
Exactly. So instead of any of those things, we refer to it as persons living with HIV. So that's what
Right.
we use if someone has HIV, they're living with HIV because it's manageable, right? You can live with it. You can live a normal life with HIV because that's where we are right now in our society. So I
Right.
think those are some good tips around that. Um, Otherwise, I see Roger. Greetings. Hello.
Yes.
Um,
And
we also got a question that are there any long-term effects on the body of using PrEP? Do you want to take this, Marshun? I can take it, doesn't matter.
you can take it, it's fine.
Sure, sure. So long-term effects on the body using PrEP. So PrEP is pre-exposure prophylaxis. So it's a
Hmm.
daily pill that you can take that prevents against HIV. So if you
Right.
take it every day, there's up to a 99%, it's up to 99% effective at preventing HIV in your body. Um, there are a few long-term side effects that are possible, but I definitely want to stress that they're incredibly unlikely.
Right,
Um,
like bone loss and things
yeah,
like
so
that.
the two main long-term ones are like kidney function and bone loss.
Hmm.
I always say with those, however, is that when you are on PrEP, at least with Whitman-Walker and most other providers do require this as well, that when you are on PrEP, you're required to get blood work done every three
Right.
months. And with that blood work, they do a metabolic panel that shows a lot of possible markers of those long-term side effects possibly taking place, especially with kidney function. So, like, if there was some sort of thing that started to happen with long-term side effect, we would know about that, and then we can course correct and maybe take you off PrEP or explore other options. So
Right.
we're always monitoring those things too, even if there are some long-term side effects taking place. But that's a good question. Thank you.
Yeah, and there's two forms. We have the SCOVY and PrEP,
Mm,
and people, everyone's body responds to things differently. So your body will
exactly.
respond differently to the SCOVY than Truvada. And PrEP is something that we do suggest, but it's not something we just expect you to take for your entire life until you die.
Yep.
It's
Exactly.
something just to protect you, because of course, you may enter into a monogamous relationship with your partner, or you and your partner may just decide that you don't want to use any type of protection because you guys have been together for so long. So it just really just depends on the situation, because it looks different for each and every one.
Exactly. Just examining the tools in your toolkit, like we keep talking
Right.
about.
Mm-hmm.
Um, so, Marshon, do you want to tell us a little bit about some maybe statistics about the current epidemic, HIV epidemic here in DC?
Yes, most definitely. Okay, okay. So currently, 12,322 residents in DC are living with HIV, and so that's 1.8% of the population here. The number of newly diagnosed HIV cases in the district decreased to 360 cases in 2018, which was a decline from 721 cases in 2011, which is a 49% decline. And in 2007, there were 1,374 cases, which is about 73%. Wards 5, 7, and 8 are currently the highest rate of HIV infections in DC. So, we always recommend, getting tested. And it's also why I love being a part of Whitman-Walker, because we actually have a mobile unit and we go into the different wards that are at a higher risk for testing, just because they may not be able, to come into our organization. So I really do like that. And we also offer PrEP, when we do go into the different wards.
Exactly.
Do you mind speaking a little bit about where we see HIV in DC, JJ?
Yeah.
Like per race or things like that?
Definitely, yeah. So you definitely touched on it a little bit, but we have some more information from the Department of Health that I think is really important to get out there to see, where we're seeing HIV most in DC, in Maryland, in Virginia, like in the DMV area. So the first, we touched on this a lot with the questions back before, but like I said, 3.8% of residents living with HIV in DC right now are Black men. They identify as Black males. After that, it's Latino males at 2.1%, Black females at 1.6%, then white males at 1.5%, Latina males at 0.3%, and then white females at 0.1%. So that's the descending order of the proportion of residents living with HIV by their race or ethnicity and their gender identity. In fact, actually, Black men make up 49% of new infections currently.
Oh, wow.
And Black women make up 21% of new infections. So I think those are really powerful numbers, really disheartening numbers, I think, when you think about them too. But again, we need to know where HIV, where the virus is in order to do the work we need to do to eliminate it, get people on treatment, link to care, and also communicate a lot of really important prevention material.
Right, and it's not to scare anyone, because
No.
we're always here if you need help, if you have questions or any concerns. Whitman-Walker, we're always here to help assist you in any way we possibly can.
Yes, for sure. And then to go a little bit deeper as well, when we're talking about modes of transmission and like sexual orientation too. So Black MSM, or men who have sex with men, and Black men who have sex with men who are also intravenous drug users make up 28% of newly diagnosed HIV cases too. So that's another layer that we have to add, where men who have sex with men are also, we're seeing that they're are comprising more of the newly diagnosed HIV cases here in DC. Another, I think, really strong big one are Black heterosexual women are at 13% of newly diagnosed HIV cases. And this is all in 2018. So this is not old data by any means, but we're still seeing these same trends today.
Right.
And this is why we're really passionate about the outreach that we do, and really intentional about the outreach that we do, to make sure that the communities who are most at risk that we're talking about here are getting the help that they need, and that we're here for them at Whitman-Walker.
Okay.
Yeah. So
comments and see.
So Roderick said CDC guidelines are to have a comprehensive metabolic panel. I promise I can speak.
Yay.
Fridays. But Marshun, do you want to talk about we already kind of went through these HIV testing options because we had a question about them before, but do you want to just do a quick refresher of what those are?
Okay, so we have two options for HIV testing, and we offer both at Whitman-Walker, although not currently. But like I said, we can refer you to organizations who are offering these options.
Yes, call the number below.
Your first option.
I got it. I feel like a real YouTuber, a real TikToker.
Okay. So your first option is the INSTI test, and that's a finger prick test which takes about maybe like 60 seconds for you to get your results back.
Yep.
And that's our third generational test. And it has a 3-month window period. Our second option is a blood draw. And so that's called the fourth generational test. And it looks for the P24 antigen, which is a core vitamin protein. And that window period is around 2 weeks or like 18 days. And like I said, we aren't currently offering HIV testing at Whitman-Walker, but if you call the number we pinned below, we can update you and help you on finding resources to get you or whomever tested accordingly.
Yes, we're here for you.
Period.
So, Marshun, I think it's an exciting time now in our conversation because it's time to talk about our 4 favorite letters. Task.
Yes.
We get some claps. I want to see some claps in the comments too, because we.
Yes. Whenever we say task, we need to see hands, baby. Hands clapping. Okay.
For sure. So, do you want to talk about what task is?
Yeah. So, task is treatment as prevention, which refers to taking HIV medication to prevent the sexual transmission of HIV, and it is one of the most highly effective options for preventing HIV. Like I said, people living with HIV who take their medication daily as prescribed and keep an undetectable viral load have effectively no risk of transmitting HIV to their HIV negative partners. TASK only works. TASK only works when a person living with HIV takes their HIV medication exactly as prescribed and has regular follow-ups, which include regular viral load tests to ensure that their viral load stays at an undetectable status. People with HIV should take their HIV medication as soon as possible. There's really no need to hesitate with taking your medication. And this medication is called ART, or antiretroviral therapy. And if taken as prescribed, like I said, it reduces the amount of HIV in your body, which is your viral load, to a very low level, which keeps the immune system working. It keeps you feeling well. It keeps you living a normal, healthy life. This is also called viral suppression, which is defined as having 200 copies of HIV. Having less than 200 copies of HIV per milliliter of blood. And it, like I said, that just means you pretty much suppress the virus in your body. HIV medication can also make your viral load so low that it can't be detected on the test. And this is also called an undetectable viral load, which brings us back to the U equals U point. We brought that up earlier. Undetectable equals untransmittable. And I guess, JJ, you could maybe like speak a little bit more on U equals U.
Yeah, definitely. I mean, we talked about it before, but just again, U equals U. So it's like the actual letter U equals U. When I first learned about it, I thought it was like YOU equals YOU, and I was very confused for a while.
Yes.
I was like, what do you mean U equals U? So it's the actual letters, and they
Like
stand for, U equals U stands for undetectable equals untransmittable. So someone who has an undetectable HIV viral load cannot, all caps, underline, highlight, cannot transmit the virus to someone else through sex. Period. And it's really important to get this message out there since HIV is still such a highly stigmatized epidemic here in the United States. The more knowledge we have, I think the more powerful we can be to really get rid of this epidemic. And U equals U, like Marshun said, such an important tool to stopping HIV transmission. And knowing that if you have HIV, especially with long-term survivors awareness day today, knowing that people who have been living with HIV for a very long time, if their viral load is undetectable, they cannot transmit the virus to their partners through sex is so affirming, I think, for those survivors.
Right. And I love You Cause You just because it's a campaign that just helps destigmatize the whole like spiel of HIV, just because there's such a huge stigma around HIV. And it's just it can get really crazy at times. But I love how You Cause You is it's straightforward, it's facts, it's something you can remember, it's not something so technical, like you don't have to be a doctor to understand it.
Exactly.
It's just undetectable equals untransmittable.
Yep. And then before we get to the end here of our conversation, which we're getting to, which we're gonna read some quotes actually from some HIV long-term survivors. We also want to touch a little bit about how you can have sex safely around COVID-19. So we've been talking a lot about HIV. We're
Right.
living in extraordinary times right now too, so we want to make sure you're being safe. Also with the pandemic going on. So, Marshun, I know you've got some tips here to share with us. Do you wanna share those real quick?
Yeah, I have some cute little tips for us to keep
I
in
knew you
mind.
did. I knew you would.
Okay, so as we know, COVID-19 is a virus that can be spread when you are within 6 feet of a person with COVID-19 who either coughs or sneezes. It can also be spread through direct contact with saliva or mucus. It has been found in feces of people who have the virus, although it hasn't been found in semen or vaginal fluids yet. When it comes to having sex, and I know it's kind of scary because we're supposed to be physically distancing ourselves from individuals. But when it comes to you having sex, you, JJ, and
You.
me, we are safest sex partners. And masturbation will not spread COVID-19, especially if you wash your hands and or sex toys with soap and water for 20 seconds before and after sex or use. Um, and so, like I said,
Exactly.
I'm just gonna keep giving it tips. Your next safest partner would be someone you live with. So maybe like your roommate or like
Hmm.
your buddy you're staying with,
Anyone you're
whoever is
with,
in the
yeah.
same household as you. Um, and yeah, having I'm sorry, I lost my train of thought.
You're
Friday.
fine.
Having close contact, which includes sex with a small circle, also helps slows the spread of COVID-19, says the New York Health Department and Whitman-Walker Health. You should also avoid close contact, including sex with anyone outside your household. But if you do decide to have sex with individuals outside of your household, we recommend you having as few partners as possible and be mindful of, PrEP, PEP, condoms, dental dam, things
All
like that.
that. Yep.
And for those who meet their partners online or make a living off, having sex online, we expect for you to consider, maybe taking a break for those in-person dates, maybe trying video dates or like upping your
Hmm.
nude game, maybe sexting or joining chat rooms. Just because they're a safer option for you and your community.
Hmm.
And like I said, condoms, dental dams, PrEP, they're also ways to help reduce the transmission as well. Um, and I just want to reiterate washing your hands and your sex toys for 20
Definitely.
seconds with soap and water. Just because I know like we're locked in the house and we may just do what we want to do, but we want to be mindful. Always wash your hands, babe,
Hmm.
and your sex toys with soap and water for at least 60 seconds. And you can just let it dry on the side or whatever and come back to it
Yeah.
and put it up whenever. Um
I think,
another thing that I want you guys to remember is that kissing can easily spread COVID
yeah.
19. So that just reiterates us suggesting you to physically distance yourself from
Yeah.
individuals because, of course, like if you are engaging in sex, you are doing it, you are at a higher risk of transmitting it. Um,
Yeah. I think you've covered it all, Marshun. I think
yeah.
you very, very detailed, lots of information.
I'm trying. I'm just trying to give the kids the details because I mean,
Yeah,
like I said, I know video chats and sexting, that's a new alternative for us, but
definitely.
it's your safest alternative and it's safe for everyone it's safe for everyone except for maybe, like your phone bill just because of like data usages.
True.
But yeah, and speaking of phones, be sure to wipe your phones down too and like your
Hmm.
glasses and like your AirPods just because honey, germs are
Yeah.
everywhere.
It's
They are
definitely just good
everywhere.
to get it all eliminated. We've
Yes.
posted a ton of information about all this too in the past. Like Marshon's done some lives on this, which we still have posted. We've
Mm-hmm.
had a lot of graphics go up. So if you need to hear any of this information again, it's already up on all of our social media. So check all that out too.
Right.
And
And be sure
mhm.
to remember you guys, if you're close enough if I'm sorry, what am I trying to say, JJ? Dang. If you're close enough to have sex, you're close enough to be exposed to COVID. So just be sure to physically distance yourself.
Definitely. Well, thank you very much, Marshun, for all of that.
No
Again,
problem.
Whitman-Walker, we are here for you for prep, for PEP, anything COVID related. Call us at that number below. That's pinned right below, pinned, and we'll connect you to any of those resources. So before we end our session here, in celebration of HIV Long-Term Survivor Awareness Day, which is today, June 5th, we want to read some quotes from some long-term survivors of HIV to really lift their voices and celebrate their stories. So
Yes.
Marshun, would you want to start with the first one?
Yes. Our first one is from Michael, and he wrote about the changes in the HIV treatment. And he states, at the beginning, there was like 18 AZTs we took a day.
Yeah.
That was it. There was nothing. The new drugs came out in the early 90s, and it was hope. Hope to me is hearing other people's experiences.
Well, yeah, we've come so far in terms of
Yes,
treatment, and I think that's definitely something that calls for celebration.
absolutely. Just because there's so many different options that you
Mm-hmm.
can start, depending on how your body, responds to different things. So it's not just like one set pill you have to take, and especially not as many as back
No,
in the day.
definitely. So the next quote we have is from Tony, and Tony shares why he believes in a practical approach to managing HIV. So Tony said, one of the things that I believe in is there has to be a practical approach. Is your housing stable? Do you have a job? What about school? Are you in a safe place? All those kinds of considerations matter because if those things are not in sync, then there will be challenges to you staying adherent to your HIV medication and staying engaged in your care.
Okay.
I
And
think,
then
yeah,
my
for me, that really speaks to what our mission is as a community health
yes.
team, is to really consider what those challenges are and to help you as much as possible to stay adherent to your HIV medication, keeping in mind those barriers that might work to make that a challenge to you. So
Right, and that definitely barriers that HIV positive individuals face just because, like,
mhm.
housing, where you're going to store your
Yep.
medication, where
Do
you're
you
going to
feel
get the
safe
medication
keeping the
delivered.
medication on you? All those things. Yeah.
Yes, like, it's just so much to think about.
Yep.
And so another quote we have is from Tony, and he wrote about growing to mentor others navigating the HIV process. And he shares, I think that being a mentor is one of the most rewarding things I've ever done. Mentoring has given me a gift that I could never foresee coming. I see their eyes becoming clearer when they have figured out a way to get through the fog of HIV. It is just the best thing. One of the best things I could have ever been a part or had a chance to witness. I have been able to fight stigma and confront it in real life, in real time, with my faith and my story. And I think that that is amazing, just because a lot of people do struggle with receiving a positive HIV status, but
Yeah.
it's just amazing when you see individuals, push through it, wipe that blurry lens off, and really just learn to love themselves and understand that you can still live a healthy lifestyle. It's not a
Yep.
death sentence.
Not at
You know,
all.
you can still engage in sex. It's not like you have to stop having sex. So I really do appreciate that. Thanks, Tony.
Yes. Thank you. Yes. Thank you to everyone who shared those quotes for sure. Those were so powerful, and I'm so happy that we were able to raise some lift those voices up to celebrate today.
Absolutely.
Um, so I don't think we had. Let me scroll through the comments real quick to see if we had any more questions. But if not, that is the end of our little session here. Definitely make sure to follow all of our social media. So at
Yes.
Whitman-Walker, Real Talk DC, also the
Mhm.
Corner. Those are where we are going to keep providing you with the most up-to-date information on what's going on, especially with the COVID-19 pandemic, and future Instagram lives here with us, the community health outreach team, your favorite employees. You know how it is.
The live OG.
Oh my God. Definitely take care of yourselves. I know there's a lot going on right now.
Yes.
Black Lives Matter, period.
Absolutely. Period.
Um,
Period.
definitely, yeah. So enjoy your weekend, Marshun.
Thank you. And everyone, feel free to reach out to us, whether it's on
Mm-hmm.
Instagram, if you want to call, we'll always assist you the best way we can if there's ever anything you need. Even if you just need to talk to someone, we'll chat with you just because we know everyone, we're all going through things differently. We're battling our battles differently. And it just feels good to have someone who's supportive. And let's always remember, Black Lives Matter. Period. Okay, well, thanks, JJ. I miss you. I'm
I
going to
know.
miss you. I hope you're staying safe, and I hope you have a wonderful weekend.
All the same to you, Marshun.
Thank you. Bye.
All right, bye, everyone.